Thank you, Chairwoman, and thanks to the ranking member as well. This committee has a long history of working on a bipartisan basis to combat the threat of opioids and substance use and misuse. And together we're making significant progress. But unfortunately, the COVID-19 pandemic and the resulting economic downturn over the last year has weighed heavily on the American people and has only exacerbated substance use and misuse. And so today we're continuing our work to address the epidemic within the pandemic, essentially. The statistics are alarming. In 2019, prior to the pandemic, more than 20 million Americans experienced a substance use disorder, and half of those involved opioids. Tragically, there were nearly 71,000 drug overdose deaths. And recent data shows that the pandemic has accelerated overdose deaths. From August 2019 to August 2020, 88,000 overdose deaths were reported, the highest ever recorded in a 12-month period. The primary driver of these deaths was a dramatic increase in the availability of synthetic opioids derived from fentanyl. These low-cost substances can be 50 to 100 times more potent than morphine and are frequently mixed into other drugs like cocaine and methamphetamine. To combat the opioid epidemic, the committee advanced major pieces of legislation that became law. These laws expanded critical substance use disorder services and supports for communities around the country, but our efforts have not ended there. And since the beginning of the pandemic, we pushed for the inclusion of funding aimed at the dual public health threats of the virus and rising rates of overdose deaths, substance use and misuse, anxiety, and depression. And I look forward to hearing from our panelists about the implementation of these laws, how the pandemic is impacting people suffering from substance use, and what more can be done to help aid in response to these threats. Now, on our first panel, we'll hear from the acting director of the White House Office of National Drug Control Policy, or ONDCP, who recently released the Biden administration's first-year drug policy priorities. And I commend the administration for taking an evidence-based public health approach to the drug epidemic. I also applaud them for their plans to expand evidence-based treatment, reduce youth substance use, enhance recovery services, and advance racial equity. Their work falls squarely within the jurisdiction of this committee. I look forward to hearing more from ONDCP about how we can work together. And our second panel is composed of experienced providers, public health experts, advocates for justice, and federal law enforcement professionals. This group is on the front lines of the epidemic, and their insight on the impact of federal policy is invaluable. And I thank all the witnesses for their selfless dedication to this cause. Now, throughout our discussion, it's important to remember that substance use disorder is complex but treatable. Regardless of a patient's personal history or healthcare coverage, they deserve compassion and help, just like any other patient with a diagnosable disease. And we have to approach the substance use epidemic as a public health crisis and take the lead on destigmatizing effective treatments. The 11 pieces of legislation we're considering today tackle the epidemic in multiple ways, and many of them take a public health approach. And we've considered some of these policies before, and they remain a critical component of a comprehensive response to the crisis. So we have to continue our work in a bipartisan fashion to combat the epidemic. Millions of lives depend on it, and I commend the sponsors of these bills for their leadership and look forward to our continued work to address this devastating epidemic in the months ahead. Thank you again, Madam Chair. I think this is a very important hearing, and I yield back.